I want to say good morning to everyone. I thank you for coming this morning. A group of mayors, Mahoney Valley River mayors, got together because of the COVID-19 to talk about what mayors could do to give their citizens a sense of comfort and give them more of an education of what's happening in our community. The number one thing that we came out of the conversation was to stay home if you're sick. If you're feeling sick, stay home. I think we're going to learn a lot more about how to become different in our lifestyle that we typically don't do. I know for me as mayor, I often like to shake hands, hug, and be in a social atmosphere. That life for me is going to change over the next 30 to 60 days. And citizens are going to have to learn that if you have public meetings, they may be canceled, or we may even go to a conference call for meetings. If you have meetings and gatherings, the governor did put out that there will be a large crowd gathering order that was put on by the governor, and we're asking everyone that's out there to adhere to that. It may be not you who are sick, you may be the carrier, and or taking it home to your family and your friends may be a bad idea. So when we're out for our social gatherings, we make sure that we are cognizant that we have to do it. Don't take a risk. If it's not necessary, if it's nothing that can't wait, postpone it. For me as mayor of the city of Youngstown and the other mayors in the room, we're going to limit access to our city halls. Right now, we're going to suspend in the city of Youngstown face-to-face water bill payments. If you're coming in to pay a water bill for the next 30 days, we're not having citizens come in to pay that. We're going to make sure that also you can pay online or by phone. Staff will be there on the phone to help you through that process. They will be able to answer those questions for you. If you're coming for a permit, call the department before you come. Security will be asking where are you going, because this is a lot more about us doing things now than not waiting for later on for issues to come to a greater head for this community. Also, I want to make sure the citizens know that we're still voting. Voting is still going to happen on Tuesday, March 17th. The Secretary of State called and asked that I make sure that I reiterate that voting is going to happen, that people learn that there may be some off-peak times that they're going to ask people to go and vote, and early voting is still happening. That may be a great opportunity for you to go today as well as up till Monday. We want to make sure that they're looking for poll workers, because we know many of our poll workers are mature age, and they are most vulnerable right now. So we want to make sure that they're safe and they're not out at the polls. So they're looking for volunteers. There may be, you'll see the courts eventually talk about limited contact at the courts, where if you're not party to that case, you won't be allowed into the courtroom. The judges will be making that call, so you'll see that if you're not on the docket, the security may not let you in if you're not a party to that case. There may be certain opportunities for individuals who have serious health issues, and we're going to have our health director talk a little more about that. But if you are of serious illness, self-quarantine yourself. Take the precaution. We all have to take the precaution during these tough times. But the life that we knew last week, I believe even the life that we knew on Monday, has changed. When we leave from this press conference, the life that we know right now after we had this conversation is going to change for all of us. And as mayors, we want to be consistent. We want to make sure the citizens know that we're working as a great deal together, so that we have a message that everyone's looking at to say, here's where we are. We are taking our cues from the governor and the director of health, Dr. Acton, to make sure that we are doing what we can do on our part. And I'll have my colleague, Mayor Doug Franklin from Warren, talk a little bit about more of some of the actions that the mayors are taking throughout just the valley, because this is not just a Youngstown issue. It's not just a Warren issue, not a Struthers or Camel or Niles. It's an issue throughout the world and throughout our community. Mayor.
Thank you, Mayor. Good morning, everyone. As Mayor Brown, first of all, I want to thank Mayor Brown for taking the leadership and bringing us all together, the healthcare professionals, state officials, and us mayors. We're fortunate as the Mayor's Association that we worked on a lot of projects in the past, so we're sort of prepared to extend that collaboration to this issue. As Mayor Brown said, this virus COVID-19 doesn't respect or limit itself to political jurisdictions or cities or communities. So we're working across those jurisdictions to work together and to speak with one voice as mayor. So that's very important. I can't say enough about how it's refreshing to exchange notes with the healthcare professionals. We're taking our directives as all of the communities represented here straight from the Ohio Department of Health. I will say that with Director Colbert, who's here today, my Safety Service Director, we've taken on a lot of the same measures that Youngstown has. We will be extending our income tax preparation deadline for 30 days. We're limiting, or if not eliminating, all person-to-person exchange of water bills. We're working with our court systems to limit access to that. So we're working on those issues, particularly with social gatherings, face-to-face contact with everybody. And I just want to say one thing before I turn it over to the other mayors. We need to be prepared. We need to practice prevention, and that trumps panic at every single instance. So I'm asking all of us to do that. We need to really focus on those preventative measures that you're going to hear over and over and over again, but they're extremely important, and we want you to take heed to those. So I thank you for calling this press conference. We got a lot of work to do. We're also we're going to copy your Zoom press conferences with our department heads. We're going to limit that as well, and also limit access to City Hall to some extent. But government has to keep running, and we will. But we'll be doing it in a different way, and all of our lives are changing as we speak. So thanks, Mayor, again, and God bless you all, and let's roll up our sleeves and get this thing under control.
This time we'll have Dr. Kravick from Mercy give us kind of an overview on the medical side of the world of what's going on.
Good morning. My name is Dr. Jim Kravick. I'm the Chief Clinical Officer at Mercy Health in Youngstown. I also serve as the Mahoning County Public Health Medical Director. And I was asked to speak a little bit about the preparedness of Mercy Health both in the hospitals and also in the practice sites, and to help the community. And really, this has been going on, as many of you know, since early January, with learning about what's going on worldwide. And as we've continued to learn, both Mercy Health locally as well as system-wide has worked very closely with health departments in Youngstown and Mahoning, Trumbull, and Columbiana counties to take their lead. Really, this is a public health business that we're working with the health departments, both local and Ohio Department of Health, as well as CDC. The CDC and the Ohio Department of Health give us great guidance, and we are listening to Dr. Acton and Governor DeWine for their updates and their guidance. Locally, as we handle our hospitals, as you know, Mercy Health has St. Elizabeth in Boardman, St. Elizabeth in Youngstown, and St. Joseph in Warren, as well as many access points of care, including 25 primary care sites. As we continue to focus in, you're going to continue to see changes, some of which have already happened and some that are going to continue to happen, and this is part of our plan. For example, you saw the tent that went up in the parking lot of St. Elizabeth Youngstown Emergency Room yesterday and the day before. That was part of our plan that was put into place in January as we continue to see increased volume and to care for our patients in need. And part of the plan is how do we care for more patients with respiratory illness, flu, the novel coronavirus, and other respiratory illnesses, and how do we handle the increased volume? And that is one area we thought would be a great way to take care of the patients. So it's part of our disaster planning that we've had in place for years. And you may continue to see other changes like that at our hospitals and office-based practices. The question comes up about where do we go if I want to get tested? That question I received many times is, how can I get tested? If you are well, if you do not have symptoms, if you have very minor symptoms, you cannot get tested right now. The testing is limited because we don't have enough tests available. That will continue to change by the day. By the hour, we get updates. So right now, Mercy is working, and we'll have, hopefully by Monday morning, two new sites of care that will be open, one in Trumbull County and one in Mahoning County. More details will follow about those sites of care, but the point of those is having more access for care, and details of who should go to those sites and what services will be offered there will be forthcoming when we have more information. But we want people to call their physician if they're concerned. The emergency rooms are always busy, but we need to keep those for patients that need to be in the emergency room. It can't just be for I want to get tested. It's not available right now. There are criteria for testing. There are algorithms the health professionals follow as far as when you can get tested, and we must involve our health departments and our infection prevention folks to decide if we test or not. And so that's a very important fact. Labs are getting certified through the government for testing, and that is continuing to evolve. I heard one more company last night received approval, and that's a good thing. But right now, we don't have numbers of tests available that I can tell you we have, but we know that will continue to increase. Last point I have is really as far as visiting restrictions, both at nursing homes and at hospitals, you are going to continue to see limitations and restrictions. We will have more announcement from a Mercy Health standpoint later today as far as our limitations on visitors. It's very important for the social distancing. We know that patients want to have visitors, and it's very important for their physical and mental health, but it also is very, very important to keep people away that don't need to be there. Mayor Brown mentioned about limiting access in City Hall, and Mayor Franklin said the same thing. So as we look at our facilities, our nursing homes where our most vulnerable patients are, we don't want to contribute to harm by having people close who might be sick and spreading that around. So I guess my take-home point is we are prepared for what's happening, continue to evolve, and most importantly, we work with the state and local health departments. Thank you.
Could you touch on what the Congressman said about kids at 17 and under during the virus, and not that there's people, grandparents and things like that?
So according to the CDC, the most vulnerable population is those over 60, and we know that. We know that many of the children, 17 and younger, are carriers, and they may or may not have symptoms of the virus, but many of them have the virus. Some have symptoms of common cold. Some with chronic illnesses can get serious illnesses, but most children who don't have chronic illnesses may have either no symptoms or very mild symptoms. And limiting the connectivity between children and the older adults is very important as well, because that can contribute to the spread to those that are most vulnerable, which is those over 60. Thank you.
Aaron Bishop, Health Commissioner from the City of Youngstown.
Good morning, everyone. Just wanted a couple of things to talk to you about is just being an open communication and working with, I know with the health department. I look at yesterday, I know Eric Ryan's here. I know it wasn't easy to cancel the Cavelli Center, but everyone's being cooperative. We're working with our restaurants, working with places that house more than 100 people, what we should do. I give credit to our team here at the health department. We have our director of nursing, our director of environmental health, and our director of minority health all here. We work as a team together. I will say all the information we get to is up to date. We really work for Dr. Acton and Governor DeWine, and as soon as they get it to us, we're on a press conference every day, watching it. As soon as we get it, we put it out to our residents as well as our businesses. I just kind of keep repeating. I know yesterday I had to make the phone call to my priest at St. Christine. I know they said March 20th we could quit doing the fish dinners, but how about tomorrow just do carry out? That's kind of those hard calls you have to make, and people really look forward to that. And this is time that we're out meeting together, but that's no longer happening. So if you are feeling sick, please stay home. We are not closing down our vital statistics yet. That would be a call we'd get from our state. So right now, if you need a birth certificate, we're limiting the amount of people that do come to our health department, which is located in the Youngstown Municipal Building. We ask that if you do come, like I said, we separated all of our chairs 6 feet apart today. But for those that can, you can get your birth certificate online. It is real simple, www.vitalcheck, vitalchek.com. I know that's really important right now, especially we're so crowded right now with all the changes with the BMV and people needing to get their driver's license. So if you can stay home and get it offline, you could also call the health department, and if you send a self-addressed envelope, we can mail you your birth certificate. So we're trying to do as best we can for people not to come in to the health department, but we know that people do need to come. Again, we keep constant communication with Mercy Health, with the mayor's office, and again, I talked to all the other mayors here today, really just encourage them to work with their local health departments, put it on your websites. All of our information is right on our front page for the city of Youngstown, so that all of our residents get the same message out. And I do encourage the CDC and the Ohio Department of Health is where you should get all of your information at. You know, no others, it's hard with social media these days. And again, stay home. We see the kids aren't in school for 3 weeks. So we're going to see lots of changes. And again, they happen every single minute. We get something new. Every single day something comes out. Last week, you know, limit amount of people at nursing home. Now most nursing homes are not allowing any visitors. So you're going to see these coming through each day. And, you know, that is our job, is to make sure that you find out. As soon as we find out, we'll send it out to you. So again, thank you for your attention. And I thank all the mayors up here and Mercy Health for all your support, our team at the Youngstown City Health District. And we have a number that you can call. At our health department, there'll be someone there, and we'll put you to the right direction. I did want to make note that we do not have anyone in the city of Youngstown under investigation right now. We did at first a month ago when the woman came from China because she had that connection. We worked with her 14 days. We called her twice a day. Did the surveillance that we were supposed to, and she did not have the coronavirus, never came down with the symptoms. But, you know, that's something that we will have to do when it does come to us. Right now, there's no one in the city of Youngstown under investigation, so I just want to make that clear. So thank you.
Thank you. Anybody else, anything, Michelle, from the state side, you want to talk about budget and issues that may be coming down from the federal government?
Okay, thank you. Yes, I'm Michelle Lepore-Hagan. I represent the 58th District, and I'm glad to be here today. This is an effort that we all need to be working together, and from the local government to the state government to the federal government. I've urged our governor and our leaders at the local, in the General Assembly to release some of our rainy day funds so that we can have more money for our local government, so we can support our healthcare providers, and we need to address what is going to happen with our small businesses, and, you know, release some funds so that we can provide some assistance for them, and also our children that are going to be our school children that are not going to be able to have their 3 meals a day. We'll be working with the CEO at the Youngstown City Schools and the mayor to address those issues of how we will provide food for these kids that will be missing 3 meals a day for the next 3 weeks. So I'm glad to be here today, and I want to share the support that anything that I can do through my office. I will be working with the governors, with the mayors in my district. So thank you. I will hopefully be working with the governor to provide more local funds for our district. Thank you, mayors.
Thank you so much. What we all have to remember is that this is going to be some difficult times, some times that I can't tell you any of us in this room have had the opportunity to deal with. Kindness is going to go a long way. Flexibility is going to go a long way. To really realize that the way that we operated is not going to happen the same for some time. I know local government, we're going to operate a little different, but as citizens, I ask that you join in with us to really understand that this is not any of us by ourselves. We're all in this together, but we all must make this work together. So at this opportunity, we want to make sure that you heard me talk about earlier where we're canceling face-to-face meetings with teleconference. We're actually going to, the mayors will probably not meet again in face-to-face. We're going to go on Zoom. We're going to go on teleconference, and we're going to make sure that we continue to communicate. Talk to my cabinet that we're not going to assemble in my conference room and congregate like we used to do. We're going to go on Zoom, so we're going to go conference calls, and let's use technology to help us. We can still get the job done. We can still figure out and have communication. We just got to do it a little different. So I'll open the floor for questions if you guys have any for us at this time.
Is there any contingency plan? What if we end up with some positives in the fire department or the police department? You know, you don't have much excess staffing. Are you considering what might happen if that develops?
Our first responders, they have a protocol that they typically use more than anyone else. But Glenn, it's a good question. It's probably one of our most darkest questions that we will have to deal with. But I think when we get to that point, we'll look to our medical our staff, our directors, to give us a sense of how do we handle that. It may not be the same as usual. I may not be on the same term. I may not have the same truck. We all must coming together and figure out how do we make it work for us. But also, you know, at the end of the day, we have to deliver a service to the citizens. So we'll make it work. It may not be the way that we used to have it to work. That's probably the ones that are most vulnerable for us, for government, our police and our fire. We're no longer having our health department go out to homes. Our meter readers, we're changing out meters in the city of Youngstown for water. Part of that you have to go into the house, and some of it's outside. We're no longer going into the homes. So you just think about that, and I just want you to guys keep them in your prayer and keep them in your thought, because they're coming to help us with safety issues. But now this is another line. You know, we talk about putting their life on the line. Here's another opportunity where they're going to be exposed or could be exposed to somebody who may be a carrier or a different environment.
And Mayor, if I could just expand on that real quick. I know us in the city of Niles, but I'm sure it's the same in Youngstown and Warren.
There you go.
And I know us in the city of Niles, and I'm sure the other mayors share the same. We do have mutual aid services available in the event a neighboring city does fall into an emergency where they do have a lack of a shortage of staff, especially safety personnel. Our people will respond and provide as much mutual aid as possible. And like I said, I'm sure most of the other, if not all, other cities around the area do have those mutual aid programs in effect to help neighboring communities in the event that a shortage in personnel does exist.
Yeah, I just want to mention, the Congressman participated in this meeting, we were conferencing, but also if they adjourn today and he gets back here, we're going to do a press event. If he doesn't get back here, we may do a satellite later, probably early mid-afternoon.
Mayor Franklin, how much concern is there that if we end up with hundreds of hourly school employees not working for 3 weeks, bus drivers not working, all these people that are not working, we don't know yet what their payroll situation is going to be, but how much impact would there be on the whole economy?
I will say we understand, and we're making preparations that it will have an impact on our local revenues and our income tax collections. We will probably see some sort of spike in overtime, particularly in our safety department. So we're prepared. We will be using all of those resources, our carryover balances, and particularly our mutual aid agreements with other communities to provide those safety services. So there will be an impact. We have to brace ourselves. We're also curtailing some of our non-essential expenses and spending and travel for these very reasons. So we understand what's on the horizon financially, but we have to be more concerned about the human interest and the human health and welfare of this virus.
You guys want to talk about what the Congressman said about extending?
Yeah.
I'm a notes guy, Mayor of Lowville. The Congressman, I don't want to take your steam there, Pat, but he talked about in Congress right now, they're looking at extending unemployment benefits. They're also looking at, what was the other thing he said about 14 sick days for every employer. That's in the negotiations right now in the Senate. And I think, correct me if I'm wrong, Pat, he said that the Congress and the Senate, if this passes in the Senate, it's going to go through. They don't have to go back to the Congress to expedite those kind of things. So obviously we all know about the local economies and those folks, and unemployment's going to get spiked because no one's going to be able to pay them. So those are the kind of things the Congressman told us on the conference call, and I'm sure he'll clarify a lot more of that and those kind of concerns we all have with our employees and our businesses in our towns and everywhere else. So, but that's what I have to add.
There's a question over here.
Regarding the testing sites that you mentioned, there's been some talk in other areas of the idea of drive-through testing. Is that something that's being discussed for these new centers or any of them?
So a question about drive-through testing for COVID. And so really the limiting factor so far has been the number of tests available. According to the Ohio Department of Health yesterday, Dr. Acton mentioned there was only 1,200 tests available in the state of Ohio through the Ohio Department of Health, and every person could require more than one of those tests based on different sites of culture and swabbing. So that has been the limitation so far. So this will continue to evolve. As far as what I mentioned earlier was brick and mortar buildings that we're repurposing for evaluation of patients for respiratory illnesses. So a question of drive-up clinics may happen. We have to wait to see on the availability. Mercy is continuing to look at all of our options in our contingency planning as far as using other vehicles, other locations, big parking lots, and we've been through all of those. And right now, since we don't have a quantity of tests that I can tell you we have available right now, then once we have that, we'll continue to make changes, and we'll let you know.
And since I got you up, I got one follow-up question for you, Doctor. The New York Times had reported that as a result of this and trade between the United States and China, that some generic drugs we could be facing shortages. How is the area supply of generic drugs, and do you expect any shortfalls?
You know, I know there is some conversation, and I heard this from Dr. Acton yesterday, as far as certain antiviral medications that may be used in the early development for treatment of COVID. So I'm taking my guide from Dr. Acton and the CDC. So there may be some medications. I spoke with the infectious disease physicians at Mercy Health earlier today about what possibility of treatment. As far as your specific question for the generic drugs, I think what we're going to find is as people think they have COVID, many, as we ramp this up, they may, but many are going to have flu, many are going to have strep. And so the treatment for that, that's always a concern when we test a lot more people, is do we have a supply? I can't give you specific numbers as far as how much drug is left in the pharmacies, either trade name or generic. But I know that the more we test and the more we treat, people will be prescribed something, if it's, for example, influenza, one of the anti-flu drugs. And so I don't have numbers yet, but I know it's something that we need to continue to keep a close eye on.
I have a follow-up for you on the testing. Since you had positive in Trumbull County and that exposure ring, is the state offering more testing kits to areas where they've had positive?
So right now, from what I know, everything is managed. So that particular case at St. Joseph is managed through the Trumbull County Health Department, and the Trumbull County Health Department is managing those patients, either the points of contact. And so I'll defer the questions to them. But as far as from my understanding, and maybe Commissioner Bishop can let me know this, I believe everything is still funneled through the Ohio Department of Health in Columbus. So it's not like they haven't given more to Trumbull County, from what I'm aware. Specifics on that case, I'll defer to Trumbull County Public Health.
Councilman had a question back there.
Thank you, Mayor. First of all, Mayor, I'd like to commend you on the leadership and all the other mayors for coming together. I think this is exactly what the community needs to see in order to bring some peace and some calm to what's going on right now. So thank you all for that. My question, Mayor Brown, is I know that you were considering talking to the people at Northside Hospital, trying to make that an official quarantine station, so Mercy Health and St. Joseph wouldn't have to worry about other patients being affected and making one specific spot for people to go to. Has there been any development with that?
Doc, we talked a little bit about that, so I didn't forget. I made sure how we can work with, if that would be a location. What do we need there? I guess that was kind of my question. Since it's been vacant, is there anything that's valuable to us at this time if we get to that point?
Really, and so again, the Mercy Health plans so far have been looking at what we currently have and how we can continue to care for the patients in the community. If we see what we've seen in Italy, where the patients double in volume, then we're going to continue to look at other sites. I have been in communication with our community partners from Southwoods Health, Salem Regional Medical Center, Stewart Health, Trumbull Memorial. I have not personally had conversations about Northside Hospital. Mercy has not had conversations about Northside Hospital. That was brought up by Congressman Ryan in a meeting we had with him an hour ago. So I'll defer that to Mayor Brown to see. I don't know what's available in that building. I don't know what's available as far as equipment. Congressman Ryan asked, his concern was, do we have enough ventilators? If the answer is right now we do. We're managing our patients. We're not in a shortage of ventilators. We're not in a shortage of supplies. We're appropriately managing our masks, our gowns, our gloves. Now that said, we're making sure that we limit the use of them to people that are non-essential. For example, many days, and you see this on TV with the rounding, we would have an attending physician and several resident doctors and multiple students all kind of come in the room, and that's how we learn, and we all gown up. Now we've changed that. It's just the one primary physician taking care of that patient. We used to have lots of nursing students with the lead nurse going in. We've limited that to save our personal protective equipment. So specifically, to your question, Northside Hospital, I'll defer to Mayor Brown as far as what's in there, but I think for the good of the community, we'll take his lead.
Yeah. So what we're going to do is when I meet with my the health department team, we'll figure out if we can get a contact in there. I've done a tour, but my eye when I went there for a tour in the last 2 months or 60 days, it was not when this was not happening. I didn't go in there specifically. I was going in there kind of to see what could be the use for the building at that time. And now here's another opportunity we may be able to do. So we're going to reach out to Stewart and their upper level and see where they can be a part of this. And like I said earlier, it's not just one of us. It's not just one entity. Mercy's here, but you heard him say Southwoods. You heard him say Salem. So we want everyone to participate in this because there's going to come a time when it's all of us going to have to say, what's my action? What's my step forward to deal with this? And so we're going to reach out when we get together this afternoon. We're going to talk and see how we can make some contacts. Or if any of you are out there to have contacts at Stewart, and let Stewart know that we want them to be a part of this team. Absolutely. Joe?
Aaron said there are currently no cases in Youngstown, and we know about the case in Trumbull County. Are there any other cases in Trumbull or Mahoney County at this time?
Not to my knowledge, Mr.
Okay.
Dr. Kravik, to you.
And also, follow-up question. I know there's a lot of people who are skeptical that are saying, oh, this isn't that big a deal. Why are you closing everything down? How do you respond to those people?
We tell them we're doing everything we can so it doesn't get there. And I think you've seen it on TV with the curve where without doing all this intervention, it can get up here. We're trying to keep it below the threshold for where our healthcare can take care of everything. And so you do this early intervention, and someone brought it to me today, well, Pennsylvania's not doing it, they're right across the border. And that's not, we can't do anything about that, but we can only do what's here in Ohio. And that is to keep the intervention, keep doing what we're doing, keep that low, below that threshold for the healthcare system that they can be able to treat the patient. So, we want to make sure that we're doing all the right things that they're telling us to do. It's coming from CDC's recommendation and then, what Governor DeWine is telling us, as well as Dr. Amy Acton from Ohio Department of Health.
Aaron, quick question for you.
Yeah.
Are we in the city or any other surrounding cities for any other mayors in the room? Or since there's a shortage of disinfectant sprays and hand sanitizers, are we going to be in any way trying to get a hold of any of that for the public and offer that to the public?
Like just today on Facebook, I saw Taft Promise Neighborhood was doing little packets for neighbors to come pick up. I mean, if that can be done, I know it was on the news last night with Sparkle. They're just waiting for people to bring things. So right now, there's a low shortage of that stuff, but that would be something we could think about and talk about, at our health department. But right now, I think other neighborhoods are just trying to help each other out as best they can, and so that's where we're at right now with that.
Yeah, another question over here.
I know that you all have been talking about providing food for kids that might be getting their meals at schools, but in the case that there are parents that are still working, are there any provisions being made for childcare if all these kids are going to be home for the next couple weeks?
Thank you for that question. We've alerted our personnel on the city side, and I would think that the school system is mirroring the same protocol, just to be prepared and to get ready to make alternative child care plans. We're making all of our provisions very employee-friendly so that there's no contractual or disciplinary issues with missing time. But we've made that overture very plain to all of our workers. And I know Steve Shiro of Warren City Schools has done the same.
I know the CEO, Justin Jennings, that was one of the conversations when we first started this morning. It was about how the kids who typically look at these, going to school for the meals, how would we get the meals to them, so that there's conversation. So that's as you hear about this changes every day. So we may think about today. Yeah, here's our plan for today. It may escalate to a different process or a different plan. So what you hear today may not be what we're going to continue to keep all the time. So it changes. Someone else is coming up or no?
I was just going to address that because to address that situation, excuse me, if we do open the schools to provide food for the children, we could also access that as a possibility for a place for a daycare center. But then you have the same issues of social, not the social distancing. So it is a situation of different,
Similarly,
changing it.
For the homeless population, are there any provisions being made for folks who, are living in communal spaces and things like that?
So I know the rescue mission of the Mahoning Valley sent out a press release this morning. They're no longer allowing volunteers to come in and do the lunches. What they're doing is having like a takeout. They're preparing the food, and then they can come and get them. This is for the people that, use the rescue mission every day for their food. But the people that are living there, obviously they're still living there. There's no cases there, but I have been in talking with John yesterday. What would happen if someone were, and that would be something like the Northside Hospital. Is that a place where we could put, people, say at the mission, if they need to be displaced there? So these are all things that we're thinking about. And we also look for the guidance from the Ohio Department of Health. And, right now, we don't have a guideline for homeless shelters. And they're pushing that, at the state level. So as soon as we hear something, we'll let you know.
You're good, you're good. No, I just to answer your last question, we're meeting, I'm supposed to be there in probably about 10 minutes with the Warren Family Mission, who serves over 400 meals a day. Right around the holidays, that peaks up to 1,000. We're having a protocol and a policy meeting with them and to talk about what they're going to do. And they're doing the same thing in terms of making all of their meal services carry out. And also, the Warren City Schools, my director just informed me, will be giving, we'll have free lunches for our kids from 11 to 1 every single school day.
Councilwoman?
The mayor, talk about going back to the water and having people come in and pay the water bill thing. Are we also going to enter to the moratorium on the water shutoffs?
So that's one of the things we're considering and talking about what that looks like in a policy.
And will council have any action to do that?
Not if it's a policy. And actually, I'm learning the health director. If the health director puts that out, she had, under this situation, she has quite a bit of authority in doing so. But we'll keep you up to date. That these are policies we've not finished. Law department is working on it right now. But we want to make sure that it's in writing, because I don't want one person to say, well, I did this or I didn't do that. He put it in writing. It's there. So we'll continue to have that conversation. Councilwoman Turner, you had a question?
I did. Actually, it was just about food preparation for the children.
Yeah.
And
Yeah.
if we were going to be displaced, if we were meeting with Second Harvest, and how we could help supplement those families and where they could go.
Yeah, that's probably the most difficult. And I was on a call with the governor, with mayors from throughout the state of Ohio, and one of the most difficult things he talked about was shutting the schools down. Because where do you send the kids? You'd send them to grandma, auntie, and if they're in the most vulnerable category, then you're just sending them into that situation. But what do? You need that, that care during the day. So these are tough decisions that we have to make for us. And all of us in this room, we need to, when we leave out of here, we need to say, what part can I play in this issue? Because if it's not in your household today, someone will be affected in some way or somehow. Those who, I continuously say, if you don't have to go, don't go. I talk about, do I need to go to the gym? Yes, I do. Will I wait a couple weeks now? Probably will. I'd rather be a couple of pounds heavier in great health than jeopardize. Maybe I'm a carrier. Maybe I'm feeling fine. I'm at the gym doing my thing, but I may infect someone who's in that category, who has issues that they may need to deal with for their health. So last question, we're going to get moving.
You mentioned the vulnerable population is going into homes. Is this going to affect any of the home health care or meals that are being delivered to the elderly or?
Go ahead.
So a question about home health care and how that affects the patient. So at least from a Mercy Health home care standpoint, we're having discussions about patients that need home care. These are nurses that travel into homes to take care of patients, and there's a reason that they're signed up for that service, because they need the care. So that will not change, but what might change is the frequency of visits, or what might change is can some of the visits be through the telephone? As the mayor said, we need to use our technology. So how can our home care nurses be smarter about how they do the work? And if it's a check of medications, maybe have the patient count their medications and call the number in, as opposed to the nurse going in as frequent. But that said, just as the Department of Vital Statistics can't stop functioning, the government can't stop functioning, home care can't stop functioning, but we can be smarter about it, such as what Aaron Bishop said about having chairs 6 feet apart. Maybe when the nurses come in, there's different changes that happen. So.
Thank you guys so much. We'll continue to keep you updated as we have information that comes our way.